Hey, good morning, everyone, and welcome to the UroPatient podcast. I'm your host, Vic Sinise. Glad to have you on board today. So today we're going to get into our show. We got a great show. Just so you know a little bit about me, I'm your host and producer of the show, and I've been a urology nurse for over 40 years, and now it's time to give back. So this is why I put this together. Today we're going to be talking to you about medical therapy for BPH. Now, last week's episode was focused on BPH. So if you haven't seen that one, go back and check it out. Now, what is medical therapy? Well, it's basically drug therapy that you take to help relieve those symptoms that we talked about last week from enlarged prostate. And there are a group of them. So the first two are alpha blockers. These are things that can help open the prostate, something called 5-alpha reductase inhibitors, which can help to shrink the prostate. And then you can combine those two together. And there's a drug out there that does just that called Jalin. Tamsulosin and dutasteride are put together in one drug. So those are available. There's also drugs called phosphodiesterase 5 inhibitors, PDE5 inhibitors, we call it. And there's only one of those out there, and that's called Cialis, Tadalafil or Cialis. And the other is phytotherapy, which are some over-the-counter stuff, and we'll talk a little bit more about those as we get there. So let's talk about the alpha blockers. So how do they work? Basically, we take a real tight muscle, your prostate, and relax it like we see here. And it's interesting because we talk about alpha blockers. Well, there's receptors inside the prostate called alpha receptors. And when we block those, what happens is the musculature inside the prostate relaxes, as we kind of see in this diagram. Well, if it relaxes, it'll help open up the prostate's obstruction and allow for better flow. So all those drugs will help you to urinate by blocking that. So let's talk about what those drugs are. So the kind of granddaddy of the alpha blockers are something called Terazosin or Hytrin and Doxazosin or Cardura. They came out first and again, work really well. They aren't used too much anymore. One of the big issues with those is inconvenience. So basically you take it at bedtime to minimize the risk of dizziness. These were originally blood pressure medications and they can lower blood pressure, especially when you go from sitting to standing. So that's really a caution. With those two drugs, we always start patients on a very low dose and then what we call titrate or kind of work them up to higher dosages. And you don't want to hit somebody with a high dose right away because that's going to lead to that possibly fainting situation. Should always swallow the tablet whole. Don't crush it, chew or break it. We say that with all medicines that are time released, and those are both time released. Work well if you're on them and they're working. Great, stay on them. The newer alpha blockers are Tamsulosin and Alfuzosin, or Flomax and Uroxatral, which are all generically available now because they've been out for a long time. Again, taken orally once a day, usually 30 minutes after the same meal. As we mentioned, you don't want to crush or chew it. And again, when you first started, especially, you want to avoid standing up suddenly because we call it orthostatic hypotension or a drop in your blood pressure when you go from sitting to standing. That can be dangerous, so be careful. With Alfuzosin, there is a little more of a warning. So even though we recommend taking these on a full stomach, you have to take Alfuzosin with food because otherwise it can be increased. It'll increase the amount that's absorbed and could lead to that fainting situation. So be sure if you're using that to be careful. The more recent one, Silodosin, Rapaflow, came out. Again, it's a once a day pill. After the same meal, about 30 minutes after it, don't chew or break it up. These all have time release medicines have to be taken as they are. Again, works the same way as the other two. Now, one of the warnings I will give you if you're on any of those medications I just mentioned is something called floppy iris syndrome. And this is especially a warning that you need to let your ophthalmologist know if you're going under for cataract surgery. So it's the only time it's going to affect you. So if you're on those medicines, make sure they know. Now, it doesn't mean they can't do the operation. Sometimes they may have to stop the medicine temporarily. Your ophthalmologist will work with your urologist to figure that one out. But it is very important that they know that because some patients go in and they, eliminate saying certain medicines for, I don't know why, but maybe they might be self-conscious or something. But anyway, very important about that. As long as they know about it, not a problem. This was really early on when it was first being used that some of these ophthalmologists were discovering this issue. So just a warning. Now, here's another warning for you. the way we talked about those alpha receptor sites in the prostate, we're blocking them to make it open. Well, just like we can make it open, there's things that can make it tighten. And one of the big culprits are cold pills, especially the ones that contain antihistamines like Sudafed. Those things can tighten up the prostate. And a man who's getting by with an enlarged prostate could find himself completely unable to urinate by taking cold medicine. We find a lot of patients who come in the office during wintertime because of that. So that's a little word of warning. That's the medicines work the same way. Now, our next group is called 5-alpha reductase inhibitors. And I talked earlier episode about how testosterone is converted to dihydrotestosterone. And that's the more potent thing, which causes the prostate to enlarge. So if you were to block that enzyme, which is what a 5-alpha reductase inhibitor does, then less testosterone is being converted to dihydrotestosterone. And what can happen is the prostate will shrink. And that's what they found out. And the first drug that came out to do this is called finasteride. It's taken as a tablet once a day, 5 milligram dose. Can be taken with or without food. This one does not affect blood pressure at all, so you won't have any problems with such things as that. And the one big thing about it is it's not an instant pill. You don't, unlike the alpha blockers that we're talking about, which can give relief pretty quickly. This is going to take several months sometimes for the prostate to shrink down enough to really start noticing the results. Now, shortly after that one was introduced, a new one called dutasteride came into the market. It works the same exact way, same type of drug. They claim because it's a dual action that it works better at blocking the changing from testosterone to dihydrotestosterone. But I don't know that I've seen it work any faster. So just be aware there are two choices. Now, one of the things that is important about this particular set of drugs, it doesn't work on all size prostates. So the really small prostates, like a normal size prostate, you can't use it at all. It's useless. Also, super big prostates probably aren't going to have a good result. It's really that first part of the enlargement, that golf ball size, 40 cc prostate. Those are the ones it works the best on. And it's also pretty reliable that it's going to reduce the size of your prostate by about 30%. So if you've got a 100 cc prostate, it'll go down to 70 cc's. And whether that's going to be enough to help you urinate, you'll only find out by trying the drug. But that's how it works. Another word of warning is if you're having a PSA done to check for prostate cancer, make sure the doctor that's ordered it is aware you're on one of those drugs, the 5-alpha reductase inhibitors, because they can cause your PSA almost very reliably to be half. So it still doesn't mean it's going to make it so that they can't tell whether you've got a risk for prostate cancer. But a PSA of 4, which would be probably considered normal if you're taking, something like finasteride or dutasteride, is actually a PSA of 8. So you have to double it. So as long as they know, do the conversion, everything is good. One of the unexpected results, if you're having some problems with thinning of hair, is you may grow back hair, because those drugs like finasteride are actually marketed for hair growth at a lower dose. If you're taking it at the higher dose, it does the same thing. So some patients had come in that we put on the medicine, not complaining, but bragging about it. So keep that in mind. There is a combination therapy that became popular. Somebody said, hey, if one works good, why not 2? Because they attack from different angles. So, by having 2 different attack zones, you probably get a better result. And there is a combination therapy of alpha blockers and 5-alpha reductase inhibitors. The trade name for that drug is called Jalin, and it uses some one pill does both. Now you kind of take it on the side of how you would take a alpha blocker. So after a meal, so that you've got that protection, so that you don't have the dropping in your blood pressure, but all that stuff, the dutasteride obviously doesn't have that issue. So that's not such a big concern. But once a day, half hour after the same meal is the perfect combination for that one. And then this group of drugs, kind of interesting, PDE5 inhibitors. If you haven't heard of them, Viagra, all the erection drugs are PDE5 inhibitors. One of the drugs, only one, had the ability to actually help open up the prostate, or at least that showed enough significant change. And that's called Cialis or tadalafil, and at the 5 milligram dose. So you can take the 5 milligram dose once a day, one pill a day, and it will help to relax the prostate. And so if you're perfect pill, if you're having some issues with erections, because that daily will always, kind of be on hand to help enhance or help people that have that issue with an erection, and it'll also help you to urinate. So some people joke we got you coming and going. And then last one is something called phytotherapy. A lot of patients coming in, they want to take these herbal super prostates and all this other crazy stuff out there. Um, and they're available. The herbal supplements, things like sal palmetto, and I can't even say the other one, Pygium africanum, have been shown that they can alleviate BPH. They both work like finasteride. They help to decrease the amount of testosterone being converted to DHT. However, word of warning is you could take a pill that's very, the pharmacies or the companies that make these make sure that it has the right amount of dose in there. When you buy these over the counter, they're not controlled by the FDA. So they're just, it's considered like herbal supplements. So they don't have the same control measures. So you don't know if the dose is going to be as reliable. It's up to you. I think that the cost nowadays for the prescription versus the over the counter phytotherapies is pretty close, but they do work. So I did want to include them. Now, next week, we're going to go into starting with some of the treatments for BPH that we call minimally invasive surgeries. It's a whole new category, and it's been taking the treatment of prostate over by storm. We're going to start out with a steam treatment called Resume. So be sure to join us next week to learn more about that one, because it's going to be pretty interesting to talk about some of these surgeries. And we'll see you next week on UroPatient Podcast.